Good day and welcome to the afternoon update from the Information Command Center for COVID-19. Our regular updates have obviously been preempted over the past few days due to the live broadcast on NTN of the proceedings from the House of Assembly. But I'm back today with you, so thanks for tuning in and stay with us. As usual, the first update before we are joined in studio by our guest today. And as the country is putting measures in place for the reopening of its borders next week, as well as schools for students sitting CXC exams and the common entrance, the Chief Medical Officer, Dr. Sharon Belma George, continues to caution on letting our guards down and for every one of us to continue to adhere to the protocols. In this report from the Bureau of Health Education, Dr. Sharon Belma George speaks on St. Lucia maintaining the trend of negative COVID-19 test results.
As of May 26, 2020, the World Health Organization reported a total of 5,404,512 confirmed cases of COVID-19 globally, with 343,514 deaths. Within the region of the Americas, there was a total of 2,454,452 cases, with the number of new cases across the region still trending upwards. On May 27, 2020, the Ministry of Health and Wellness received the results of 41 COVID-19 tests that were conducted, all of which returned as negative. This is the 24th consecutive day out of a total of 382 tests conducted that we have received no positive cases since our last case was recorded on May 3, 2020. Though this data is encouraging, our healthcare providers continue to remain vigilant, screening and testing people who present at our facilities with flu-like symptoms, as we know the public health threat posed by COVID-19 is not over. We encourage everyone to monitor their individual state of health and that of their loved ones. If experiencing symptoms which include fever, cough, sore throat, loss of smell, take no chances. Please seek care at our community respiratory clinics or outside of their normal operations at the Victoria Hospital and the St. Jude Hospital. In the coming week, we'll have the return of our grade 6 and Form 5 students in preparation for their exams. During that week, we also have the reopening of the national borders to travelers. These changes will result in a greater movement of people, and with that, we note the potential for increased transmission of the virus. As such, the Ministry of Health, in collaboration with the relevant sectors, has been preparing for these changes and the risks that potentially accompany them. This includes instituting of protocols, site assessments to determine capacity for infection prevention and control, as well as the surging of our stocks of personal protective equipment. With all of this in place, we also require the support of every citizen in maintaining the recommended infection prevention and control measures to further strengthen our readiness. We ask that everyone continues to sanitize their hands by using hand washing or an alcohol-based hand sanitizer, the wearing of masks while undertaking daily activities out of home, and to maintain the required 6-foot distance. Also, be sure to cover your mouth and nose with disposable tissues when coughing and sneezing. These simple and inexpensive actions will make a meaningful difference in preventing the spread of infection. The Department of Health and Wellness will continue providing regular updates on COVID-19.
That report there from the Bureau of Health Education on St. Lucia's latest COVID-19 status. And as I've mentioned before, we must all continue to practice and adhere to the protocols, even if this means limiting or as much as possible restricting physical contact. Of course, we are aware that for the most part we are sociable people, but there's the other aspect of things where it seems to have become habitual or quite normal for folks to invade each other's space. But how close is too close exactly? Let us take in another video from the Bureau of Health Education.
Hello, today let's talk about physical distancing, why we need it, and what does it mean. Physical distancing is deliberately increasing the physical space between people to avoid the spreading of an infectious illness. In this case, the new coronavirus, also known as COVID-19. This virus spreads from person to person through a sneeze or a cough or even through talking. The droplets from a sneeze, cough, or loud speech float through the air before settling on surfaces like your countertops, tables, doorknobs, keys, or your mobile phones. It can even be breathed in if you are close enough to a person who has the virus. The virus then waits for an opportunity to be passed on to the next person you come into contact with. Staying 6 feet away from others is the best distance to avoid any spread of the virus from one person to the next. If you're waiting in line at the supermarket or the bank, follow the markers set on the floor to try to visualize a 6-foot distance from the person in front of you and wait there, even outside of the building. Why? Well, if everyone practices physical distancing, we can help prevent the spread of COVID-19 as the chances of passing it on to another person is reduced. Physical distancing also means that we do the following. Avoid contact with someone who is displaying symptoms of COVID-19. These symptoms include cough, sneeze, sore throat, and fever. Avoid the unnecessary use of public transportation, as you should be going out only when required. If unavoidable, travel with less people. Work from home wherever possible. Avoid social gatherings at bars, restaurants, as well as going to fests and casual limes, as the infection spreads easily when people gather together. Since you should not be gathering with friends and family, you can still remain in touch by giving a call, connecting online, or through social media. Unless it is absolutely necessary, you should not be visiting older relatives, as they are one of the groups most vulnerable to COVID-19. By these simple actions, we can all make a big impact to reduce the spread of COVID-19 on our St. Lucia.
And that was a reminder there on physical distancing, a very necessary protocol as much as it is difficult for some of us to practice. And finally, in our daily update, the government of St. Lucia is currently accepting applications for self-employed persons to benefit from the income support program for non-NIC contributions. Here is what you need to know about this.
As part of government's social stabilization plan to assist persons who have lost their means of earning due to the COVID-19 pandemic, the government of St. Lucia has implemented the Income Support Program, where non-contributors to the NIC shall receive a monthly payment of $500 for the next 3 months. Taxi drivers, jet ski operators, vendors, agro-processors, tour guides, hairdressers, barbers, small bar and restaurant operators, construction workers, and other sole traders who meet the criteria can apply using the Government of St. Lucia's website www.govt.lc. Payments will be made directly via electronic transfer to the recipient's bank account. The Income Support Program, simple strides towards recovery.
Some info there on the Income Support Program. And that was a roundup as far as the latest information when it comes to government's response to COVID-19. We are due for our first break, and when we come back, we'll be joined by our in-studio guest. Stay tuned.
In an effort to ensure patient and first responder safety, the St. Lucia Fire Service has reviewed its patient transfer procedures, especially for patients with respiratory distress. face masks will be provided. At no time during transportation should the face mask be removed. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
And welcome back. Sunday, May 41st is World No Tobacco Day. And in observance of this day, in a moment, I will be introducing my guest. The theme for World No Tobacco Day is protecting youth from industry manipulation and preventing them from tobacco and nicotine use. According to the WHO, for decades, the tobacco industry has deliberately employed strategic, aggressive, and well-resourced tactics to attract youth to tobacco and nicotine products. Internal industry documents reveal in-depth research and calculated approaches designed to attract a new generation of tobacco users, from product design to marketing campaigns aimed at replacing the millions of people who die each year from tobacco attributable diseases with new consumers, the youth. With me to discuss this and other related talking points is Mrs. Alma Dolor, Assistant Principal Nursing Officer, Community Nursing for the North and Manager of the Quarantine Facility. Welcome, Ms. Dolor.
Thank you.
We also have with us Mrs. Joanna Joseph Henry, and she is the Deputy Coordinator, Substance Abuse Advisory Council, Secretariat, and Tobacco Focal Point for St. Lucia. Welcome.
Thank you, Tony.
Okay, if you're very bright orange, that's the
Yes.
color for World No Tobacco Day. Sorry, I was a little late in getting the memo. So World Tobacco Day, the focus is on the youth. How are tobacco and related industries manipulating the youth? You heard in my preamble some of what is being done, but just give us a broader perspective on that.
Well, there are a lot of tobacco products that are, well, we call them new emerging products, and they really get at attracting young people. And the messages also for young people is that it's safe to use this one. It's not a cigarette, it's a heated device. You know, there's this, there are the vape pens. There's another one called juuling. There are so many different things. Sometimes you may see a young person with a tobacco delivery device, something used for smoking, and you may have no idea that it is really, you know, a type of smoking device, something to use for smoking tobacco or other smoke products as well. There's also the myth that's being used, well, being promoted by the industry that these devices are safer than cigarettes, that they're not as harmful. But then we saw all of that really debunked last year, especially in the States, where we had so many deaths, and we had quite a lot of persons developing lung disease and other lung illnesses, lung injuries as a result. And also there's this new thing, the flavors. In those devices, and also cigarettes with different flavors, and it's being, you know, promoted as not so harmful, and so this, as long as it
have
contains
some of the filtered cigarettes and all of that,
and but that's far from the truth. It's nicotine is nicotine, no matter what type of product.
No matter how you try to disguise it.
No matter how you try to disguise it, and so our message and our appeal to young people is not to fall for this, you know, and to really get the facts, get the knowledge, research, you know, and understand the product that's being put before them. In fact, what we want to say to them is to simply do not use anything that involves smoking. Added
to that, for young people, you also have the pressure from influencers, thanks to social media, be it celebrities or just social media influencers, making it seem like it's cool to use the vape and all of those other devices.
Yes, that's and you know, among young people, the peer group influence and looking cool among my friends and being one of the gang, you know, is an important identity, you know, status at that time, at that age of their development. And so we want them to understand too that that's not cool. And what might look cool in this age would really harm you, age you, because the teeth get affected, the skin gets affected. So you may look at a 15-year-old and wonder, really, how old is this person? So it really is not cool. There's nothing about it that is cool.
Why is the theme so important at this time?
I think this understanding what happened last year in the deaths and the I even saw some of those. I go back to some of those ads that I saw, and if I didn't know better, I would have been drawn in, because I remember seeing an ad about dueling, and I'm like, oh, this is a new thing, really, is it? And then until I went to do my own research. So understanding that, the way that the industry is really bent on maintaining their market share, maintaining their profit levels, and the lengths that, historically the tobacco industry has gone to maintain their, economic and financial gains. You really have to understand that the place you start in truly preventing any kind of illness is with the youngest of the young. And so this is why the emphasis is really on our young people.
Nurse, what are you seeing in terms of, recently we've been hearing a lot about things like COPD and what have you. What are the trends as a nurse that you're seeing when it comes to young persons and the influence of smoking having on their health?
Okay, you would not find a younger group having the COPD because it takes a few years to get to that state. But every time you smoke, each cigarette you smoke is as if as a drop of poison in the bucket. So every cigarette you take releases the amount of carbon monoxide to keep adding to the state where you would get to COPD. We have a lot of persons in their 30s, that's still young, relatively young.
Yes.
Who are
as the prime of your life there.
Yes, you look at these persons struggling for breath and you're wondering what went wrong. But if we have to take it back, go back from the bare basics, and you look at, let's say we look at the normal lung, if you want, if you would allow me. You have this nice pink, spongy lung, which has, if you touch it, has a bounce feel to it. And every time a person takes a cigarette, they smoke it, the carbon monoxide, what it does, it destroys, it adheres itself to the cells, the red blood cells, and it damages it. So it takes the place of oxygen and it damages the lung tissue, causing scarring, and it causes thickening. So that lung is already, like there's a struggle, because every time when you have scarring, because each lung has millions, over 600 million little air sacs, the alveoli, those tiny, cute little air sacs that get destroyed when the lung tissue gets destroyed. So what happens is that when these air sacs get destroyed, it's a big deal for the body, because that's where you breathe in oxygen and you breathe out carbon dioxide. So when these air sacs are destroyed, the carbon dioxide gets trapped in the lungs and stays there along with the carbon monoxide and destroy the lung tissue and cause scarring. So these people literally have to struggle for breath. And the lining of the respiratory tract is also exposed and gets inflamed and easily gets infected. So,
and that cannot be good news, especially at this time where we're talking about COVID-19 and the respiratory issues persons encounter.
So if we have to look at it, so if you like, let's look at COVID now, the coronavirus. The coronavirus gets into the respiratory tract. It goes straight to the lungs, because why it goes there, because it wants a cell that looks like its receptors, that is adaptable to its receptors, or compatible, to its receptors. So when it gets there, like, why is the lung it's choosing? But that's the one it's more adaptable to. They also have the same type of cell in the small intestine, but it prefers the one in the lungs. So when it gets to the lungs, it goes to destroy those cells that are very important. You have a mucus producing cell and also one we call a cilia cell. So the mucus is to keep the lung nice and moist and to prevent it from, protect it from infection. Also you have the cilia cells, which is very important, I need to explain that. is have tiny little brushes, soft brushes that removes particles and debris. So any little particle or debris or germ that's not supposed to, they can just brush it out. But the coronavirus destroys those two sets of cells. So when it does that, then in the airway there is debris and particles and a set of mucus that cannot be expelled, and it builds up. So as it builds up, now the person is struggling to breathe. So that's how the person starts to cough, because they feeling something need to come out. So they're coughing and they're feeling they need to breathe. But the coronavirus has over time would cause, in a short space of time, cause scarring and the same tightening and thickening. So it's inflamed and the person is struggling to breathe. So the smoke is doing it and the coronavirus is doing a similar thing.
Wow.
So can you imagine the person who is a chronic smoker, maybe at this point of their life already has COPD, and they get infected by the coronavirus.
It's a double whammy.
Double whammy. And there's a Creole saying, if you don't mind, I used to hear my grandmother saying, après moi j'ai tombé, ou ka ban moi pour toujours. So I'm done already and you're giving me more. Like, so the lungs in a smoker is already damaged, and the coronavirus comes and give it another slap.
Wow.
So it puts them at a greater risk of serious complications or dying. Yes.
And when you add to that, Tony, and really I love that. That was so real. I could actually picture what was happening in the lung, the way you describe it, Nurse Dolor. And when you add to that now, in the home, in workplaces, in other places where you have smokers who are smoking and affecting other people.
Others.
Who are
Affecting,
innocent.
let's go back to our young people who have no choice in the matter. This is where they live, this is where they go to school, this is where they walk on the streets. And so they are being affected, their lungs and their systems are being exposed in the same way. So they have the same sort of risk as the person who's smoking.
Okay. Going back to COVID, Mrs. Henry, in light of what we're experiencing right now, how has this now affected some of your plans for World No Tobacco Day in terms of your activities?
Well, COVID came as an unwanted child.
As you describe it.
Nurse Dolor and I were talking about this earlier, and we had, people will recall last year how, fantastic all our plans were and how engaging, and of course there was a lot of mass awareness and mass groupings involved, but we couldn't do that this year. And so we still want to keep that message out. It's a very important message. It's about life, it's about saving lives. So we've gone virtual. And we would like for everybody to, like our page, follow our page. We've started off with some of our very interesting posts there that have started already this week. And we will also be doing interviews with different individuals focusing on different aspects of the tobacco control. We've done a lot of gains in St. Lucia in implementing the sort of effective controls that we need to put in place. I guess we'll go into that a little bit, or you want me to go into it now?
Yeah, we could go. I was just about, that would have been my next question, your tobacco control strategies. So we could go into that now, yeah.
Yeah, so I'm really happy to share with the nation that the Pan American Health Organization has really praised our improvements and our acceleration of our activities and our implementation over the last few years. So it's something that we're really proud of, but more than that, we're beginning to see some reductions also in the prevalence of smoking. So that's the main thing that we focus on.
How do you measure that prevalence? Is it by sales, or how do you measure the prevalence?
Well, thankfully we have a lot of support from the World Health Organization. St. Lucia is signatory. We have signed the treaty which is the Framework Convention on Tobacco Control. And although, we're quite late already in implementing, but it's better late than never. We've, really begun to look more seriously and really get it done. So let's say within 3 to 4 years, there's a surveillance survey that is done throughout those countries, including St. Lucia. And so we've completed about 4 rounds of the Global Youth Tobacco Survey.
Okay.
So that's for the young people. And for the elder ones, the older persons, adults, there's the STEP survey that Nurse Dolor and her team have been working hard on from last year until the unwanted
COVID,
child
yeah.
came and interrupted. And so that also helps us to measure the trends and measure changes, new products coming on, prevalence, how are people smoking now, why are they smoking, and so on. So
Okay.
that's the first thing. And then
Right.
other things, the graphic warning, package labels. Everybody will notice now that on a packet of cigarette, there's a really graphic warning. So St. Lucia, we've met the standard for half of the package, so back and front, and the warning on the side. And so that is a message to persons who smoke, that it is dangerous. This is why it's dangerous, and also why it's important to stop. And it also will deter young people from smoking. And so you see why the industry will now move to another kind of product.
Interesting.
Yes.
Right? Because you need now, this is no longer interesting. It's a deterrent. I've actually heard people saying, boy, if that's going to happen to me, I don't want to be. So they want to move to another product, and always adjusting, always trying, to pull people in.
Always trying to keep ahead. But talking about keeping ahead, how far ahead are we in terms of our legislation and regulations that would keep especially our young persons safe?
Well, this is another thing that we are really, really very proud of. That's both at the Ministry of Health and the Tobacco Control Working Group. This is another very, very important committee that, falls under the ambit of the Ministry of Health, but it's a multi-sectoral group, both of civil society and of government and other agencies that come together to implement this, because as one, we all have to be in this for it to work. So our legislation, St. Lucia, as of July 2019, we do have smoke-free spaces and smoke-free legislation, right? So that means in public places from July, it is illegal now to smoke in public places, to smoke in public conveyances, whether it's a taxi, minibus, any transport that is being used to transport people, there is no smoking allowed in there. In workplaces as well, and work doesn't only apply to the one in the office. If I'm a domestic assistant and I come to work, I'm supposed to be able to breathe without being affected by anybody else's smoke. So people need to understand that. And we expect that the regulations now that really give full impact in terms of the penalties, in terms of all of the other things, the rules, the details of the rules pertaining to this Public Health Act will be going through. I know that they have been signed, and so we expect that announcement will be for the enactment of the regulations will be anytime soon.
Sounds good. Sounds good. We also have a message from the Minister of Health, Senator the Honorable Mary Isaac, on World No Tobacco Day. Let's take a listen.
Good day, St. Lucia. I wish everyone a happy No Tobacco Day. As the world celebrates No Tobacco Day every year, I am sure those who have been able to quit the bad addictive habit of smoking have realized a marked improvement in their health and life in general. By giving up smoking, not only do you preserve your quality of health, but you also protect those around you from being exposed to secondhand smoke, which in some instances can be more detrimental to health and life. Also, you improve on your economic situation by saving the finances you spend on smoking. For those who are still addicted and social smokers, mostly our young people, I say to you today, you need to remember that you are not only exposing yourself to a very dangerous killer, but you are exposing others to a potentially harsh death sentence. Non-communicable diseases such as cancers caused by smoking is among the top 10 killers in the world. These preventable diseases are also a heavy burden on our healthcare system, as well as on families who in most cases are not able to afford to pay for treatment and care. So as I wish you happy No Tobacco Day, I am pleased that many people who have kicked the bad habit of smoking can celebrate knowing that they have the fortitude to do so. And for those who have not been able to stop smoking, I urge you to look to the theme this year, which is protecting youth from industry manipulation and preventing them from tobacco and nicotine use. To educate yourselves and reach out to the Substance Abuse Secretariat of the Ministry of Health, where you can get the necessary assistance. Have a smoke-free, no tobacco day.
Thank you, Senator Honorable Mary Isaac, for that message. Earlier on, we were discussing the impact of tobacco smoking on the body. We have an image, and when I saw it earlier on, it looked very graphic. I was also tempted to put up a warning on the screen, but it's up on the screen now. And just tell us, what are we looking at right now when we see this image?
When someone smokes, because there are so many toxins, about 65 of them, over 65 types of toxic chemicals, and the one for the lungs, the carbon monoxide, it affects, when you inhale the toxin, the toxic chemicals. Remember I tell you that it adheres to the red blood cells, and it disrupts oxygen exchange, the breathe in oxygen, breathe out carbon dioxide. So that oxygen from the lungs has to circulate on the blood cells with this oxygen throughout the body. So that means anything that can flow through the blood, out of the body, can reach any organ. So that tells you that those toxic substances can affect any organ in the body, any system. The cardiovascular, the heart, it can affect the kidneys, any organ, the skin, the reproductive system, causing cancers, ovarian cancers, heart disease, emphysema, which is another lung disease that causes rupture of the same air sacs I told you, causing difficulty in breathing again. It can affect almost anything, even the sperm cells. I'm sure you could suppose if you're seeing it. It causes the deformity, so the person is sometimes not able to have children. So it is really, really a destructive thing when someone smokes. And every time you smoke, it adds up, it builds up and destroys the body in any organ.
And I also see that there's the risk of the buildup of mucus, which we are aware that causes so many other...
Yes, because you remember, as I said, that the lung tissue is destroyed. So if the lung tissue is destroyed, the mucus producing cells are destroyed. So like and the cilia cells that brushes out excess are destroyed. So when excess cannot be swept away, it just stays there and it just forms debris. There's debris and excess fluid, and it causes an issue. So that also prevents a person from breathing. So it can destroy any organ because it circulates in the bloodstream. Right. It's not just you take it in and you puff it out. It stays in the bloodstream. Yes.
I see another very interesting statistic whereby a very high percentage of persons who had severe illnesses with COVID-19 infections were smokers.
Yes. This is what exactly, because you remember the first explanation I gave you? Right. So the person who is a smoker, and the virus does a similar thing to the lung, as I explained earlier. It destroys those vital cells, because that is the organ that has the cell that is more compatible to the virus, the lung. So it gets there, destroys those two cells, the mucoid producing cells, and the cilia cells that removes the debris. So this is why when somebody who smokes get the coronavirus, they are at a greater risk of either having a serious complication or dying.
Okay. Now you also have oversight of one of the quarantine facilities?
Well, yes. So
I just wanted to bring in the whole aspect of persons being in quarantine. We were talking about the second-hand and third-hand smoke and how dangerous that could be, not only to yourself, but to others whilst in quarantine or even whilst you're at home, you know?
Yes, well, while the experience there, we had a few persons who were admitted. They presented with the signs and symptoms, and they were sent there for monitoring. And for them, it was a real challenge because those persons wanted to smoke, and there's a no smoking policy because it's a health facility. We are at a hotel space, but it's a public health facility, and there's a no smoking policy. and these people were struggling, and they presented like COVID. But some of them would tell you, nurse, because I have COPD, that's how I am sometimes, struggling to the shortness of breath, the coughing, the persistent coughing. But those persons, because they presented like that, they had to be monitored.
Yes.
So it was a challenge for us, because to keep those persons calm, they really want their cigarette, they want the cigarette, and you have to try to help them understand you are at a greater risk if you get. So persons who already have COPD, we are telling them you are at a greater risk of, if you get that virus, to have a serious issue or you could die. So they are to be more vigilant in adhering to the protocols. Social distancing, the washing of the hands, the covering, the wearing the mask to protect themselves and other people. But you know, besides that, I'm a very positive person. So I would want to tell persons, this is an environment where it gives you a chance to say, I need to take this smoking thing, the quitting, seriously. This is a chance it exposes you to say, I can really lose my life. All along you smoke, it was like drinking a little bit of Gromazone in your tea each day, but they didn't see it like that. But this is a time where you're in an environment where you know for sure, if I get the coronavirus, although we're doing well for now, but we never know what's going to happen. It's researchers have said that they are projecting another year or more, so they are still in the environment. So I'm saying, according to research, if someone stops smoking within 12 hours, the amount of carbon monoxide starts to drop right away, within 12 hours. So it gives the system a little chance, the blood cells a little chance. If you go up to like 2 weeks to 12 weeks, there is another great improvement, and there is already some more circulation and the body is so wonderfully made, you can have some new growth of cilia cells. So that person who stops smoking, it is a new, like a fresh breath for your lungs. You get circulation and you get some new cilia cells, so now it can dust out the debris, gently dust out the debris and the excess mucus, and you can breathe a little more easier. And other than that, if you prolong it, like up to you go like to a few months, into a year or so, there is much improvement. There is the coughing would almost disappear. The tightening of the airway and all that will loosen, all the inflammation and all that will be healing. It will not be a new lung, but there will be a lot of healing, new growth of the cilia cells and the mucus producing cells, and that person will feel better. I personally know somebody who has COPD who stopped smoking, and I can see a big difference. I could see a big difference. He used to walk like coming forward, you know, like guarding. They walk this way. He's more upright. He breathes better. You could see his skin is better. He had lost a lot of weight because your oxygen supply is disrupted, so you lose weight as well. So he gained back some weight, and he looks much better. He's at work. He didn't want to work, now he's at work. So at least I know this one person personally, but I'm sure there are a few more people who
But for
can
someone
testify.
who's watching and listening right now who wants to stop, but they just figure they cannot, where do they go to get help?
Well, that's one of the other things, Miss
That's
Joseph.
what we're working on. But even before the tobacco cessation clinic really comes on stream, it is being implemented, worked on in the background. We're working on it seriously. There is still a lot of help that's available. Those individuals can go to their doctors if they really struggling with the cravings and other withdrawal symptoms, because it's addictive. You know, the nicotine in there, in addition to all these other substances that are placed in there to heighten the high, so to speak, you know, really makes smoking addictive. So we understand that, you know, the first few days are really difficult. We know that, but as Nurse Dolor was saying, it's really worth that extra effort and that determination to quit now. There is limited support at this time, but there is support available. And so persons who may need a little more help, you can call the Substance Abuse Secretariat for now, and we will guide you further from there. And you can also go to your doctor to indicate that you're struggling and you may need some medication. Other than that, there are other very good quitting techniques, very simple things that people can use. So for instance, when you begin to feel a craving, you picture it as a wave. It will build to a point and then it will go down. So you don't give in to a craving. That's all it is, a feeling.
One at a time.
Yes, and you do it
one at a time.
One craving at a time. You can substitute. People who are not diabetic can use chocolates, can use sweets to, get through the craving. In some of our pharmacies, unfortunately, not just in the public pharmacy, but in private pharmacies, you can get the patch. Some people think that think it helps, the patch and the gum, nicotine gum.
Yes.
But we encourage people to use other non-nicotine ways to quit. But the important thing is, as Nurse Dolor said, this is about preserving life.
Yes. Yes.
So don't give up. I know last year we spoke to a few people who said they had tried and it didn't really work. But as Nurse Dolor said, you try one day at a time, and you add another day to that, and you add another day to that.
Sometimes, and the other thing they can do is, like, if they could, like, lessen it gradually.
Yes.
For some persons, that's how the person I know what happened. Lessen the amount.
Okay.
Like from 2 or 3 packs a day, you lessen the amount gradually, and sometimes the amount, and it disappears after a while. But it's really a lot of willpower. The person must want it. They must desperately want to. And you're doing it for yourself. You're like, it's almost like you taking the cigarette is like suicide.
Yes.
You must tell yourself, every time I take a cigarette, it's like attempting suicide. It sounds graphic, but it's the reality.
That's what it is.
That's you committing suicide. So tell yourself, I want life instead. I choose life instead. And even somebody who's listening, who's not a smoker, but know somebody, the encouragement and the support, you choose life instead. And each time you withdraw from it or lessen it or whatever means, the other means to try to get it out of your system. And you could remember there's rebuild, there's new growth, and the person can improve significantly.
Okay. We are due for another break, and when we come back, we'll look at the dangers of some of what we spoke about briefly earlier on, things like the e-cigarettes and what have you, and what are the possibilities of legislation being implemented, because I am aware that in some places they're already being banned. So we'll be discussing that when we come back on the other side of the break. Welcome back. We're here at the Information Command Center for COVID-19, and as Sunday being World No Tobacco Day, in studio with me we have Mrs. Alma Dolor, Assistant Principal Nursing Officer, Community Nursing for the North, a very long title, and she's also manager of the quarantine facility. We also have Mrs. Joanna Joseph Henry, Deputy Coordinator, Substance Abuse Advisory Council Secretariat and Tobacco Focal Point for St. Lucia. Before the break, I said we will be speaking about the electronic devices, the water pipes and what have you, which seem to have gotten very popular, especially with the young crowd. And being this year, the focus is on our youth. I just wanted to know, are there any measures being put in place? Because I am aware that in some countries, these are already being banned. What is the situation here in St. Lucia?
Well, definition in the legislation that I spoke about earlier, the Public Health Amendment for Smoking Control, we have already placed a ban on the public use of those devices. Because what we do recognize is a lot of, especially among our young people, is a young crowd, so a lot of smoking and the use of those kinds of devices takes place at bars and other social scenes. So a bar, any place that has at least one wall, will be defined as an enclosed area.
Okay.
So that means there can't be smoking of any type, including electronic devices. And the definition of smoke emissions is very wide. So it does include the electronic cigarettes, it does include anything that is smoked. Our definition of smoking too is very important because we want to send the same message. It has to be across the board, whatever the substance, whether it's cannabis, whether it's tobacco, whether it's any mixed flavors of anything, mixing this or that. People just have to understand now that in the interest of their health and health of other people, there just can't be any smoking of any kind of device, whether it's traditional cigarettes, whether it's the new things. But as you mentioned, the hookahs, that's another name for the water pipes.
Yes.
There is a very, very serious risk of infection, spread of infectious diseases.
Because these are being shared.
Exactly. Yeah. And the water in there, all the devices inside, the viruses and bacteria, whatever is in there, can stay in there for a little while, and somebody else comes, puts the device to their mouth, and they breathe in and they get infections. All right. And then the other thing about smoking is that the amount of time a smoker will take a cigarette or whatever device they're using and put to their faces. Remember, the most important protection to prevent is your mask, is also to avoid touching your face. But these substances, these products, they bring your hands very close to your mouth frequently, and so that can increase the risk and the chances of spreading all kinds of contagious diseases, including our unwanted child, the COVID-19.
So I would imagine that the legislation will have to go as far as banning the importation of these devices, not just using them. If they're banned, then there would have to be something in place as far as importing them.
Well, I think it's a good discussion at this point and a good consideration to really look at. We have not decided to have such a ban. I think we'll be looking at the research. We'll be looking at what is happening, but also these are legal devices. Tobacco is still legal, at least at this stage in our history. It is still legal, and so we have to. It's a thin line that you tread to explain to people, even if a substance is legal, it doesn't mean you must. It doesn't give anything, doesn't provide anything, doesn't give anything, add anything to life, doesn't add anything to health. What it does is destroy, and so in the absence of a total ban, what we have done is restrict the use. And we're also encouraging individuals to make that choice to avoid using altogether. Those who have not started, please do not start. You don't want to go down the road that Nurse Dolor described. You have heard of other people with COPD and other, lung diseases and other kinds of cancers. It's a very, very painful way to live life, you know. In
terms of the secondhand smoke, is there any redress, again, under the new act? I'm fascinated by that new act. I'm sure you could tell.
Yes.
In terms of someone having redress. So someone is being employed as a caretaker in a home, but they go to work and that family is always smoking. Now, that the general reaction would be, well, if you cannot take it, quit, or they'll be fired, or even in a workplace, that people are smoking and so on. What redress do I have as an individual who's not smoking but want to protect my health, being in that space of other people who are smoking? I know the easy answer, somebody watching might say, well, just leave or walk out. But what if I'm in a situation where I have to be in that environment?
The thing is that The smoker's right, I have to put it plainly, the smoker's right, people will say, well, I have the right to smoke. But no, you don't have the right to smoke if your right is impinging on the health of another person. And so having this legislation protects, that's the whole point of it.
Okay.
Protects the individuals who do not smoke. And so persons who are being affected by this will be able to report, will be able to get help, will be able to reach out to maybe the different organizations. We will be saying exactly where people can go to get help. But for instance, in a bar or someplace like that, there will be the right and the right given and power given to the owner, and the responsibility also to the owner to ensure that their patrons are protected, remove persons who are not willing to comply with even police assistance. So there's a lot that will have to come in, to make this happen. But what we do know in St. Lucia is that as St. Lucians, we are very resilient people. And when we agree with something, we understand something, we support it. And so we expect that individuals will not have to resort to this.
Okay.
That they will understand the reason for the legislation, but will also understand that they don't need to wait for a big stick to be, that people will gradually make the adjustment. But it's a necessary change that needs to come.
I definitely agree. We're quickly running out of time. Interesting discussion. Just final words, final thoughts from you, Mrs. Dolor.
Oh, I was just thinking earlier when she said that people seem to congregate to use some of the substances. And I'm saying, okay, I know I'm COVID-19, but a few good things out of it. Mostly negative we see, but there are a few good things.
Yes,
and maybe
definitely.
that's one of them. So since we had the social distancing and the no gathering and stuff, so it means that some people may have almost lost the taste for smoking because they didn't have their friends to congregate. So maybe that's one of the things. So maybe if there's somebody listening and they have lost the desire to smoke, maybe they should stick to that. That's interesting. When you said that, I was thinking, that's an interesting thing about COVID. Yes. But once again, I'd really like to encourage persons who, even though they're not smoking but know somebody, if you can do something to help to avoid the person from smoking, you are saving a life. It's just like you're at an accident scene and you want to do something. Although this, we have been saying, call for help, call the ambulance, do not move the person, but you want to do something because you see the person is dying. So look at it the same way. Somebody who smokes is going.
Although mind you, these days, they more want to take a photo of video.
Yes,
so
unfortunately.
that's another story. But
That's for another day,
That's
but
for
it's
another show.
unfortunate. But I'm saying, okay, let's say in the past, that was what. So look at it like that. Somebody you know is smoking, or if you are smoking, the person is quickly dying. So if you can do something to help the person lose the appetite for smoking, it would be of a great help for them and for us as a Ministry of Health and for the wider nation.
Okay, thank you.
Nurse Dolor took my point.
Sorry.
But yeah, it's just to echo that same message that this is the time to quit. Now is the best time to quit.
That's a good time.
There's no social pressure really, and as I said earlier, the bars being closed and the restaurants also being closed is an opportunity for individuals to really adjust and to get control of this smoking. To our young people, we say, you have not started, do not start. Preserve your health and encourage people around you to quit. And you have a right now to say, I don't want you to smoke around me. And you don't have, and when you encounter people who are smoking in public places, to alert the authorities and say, I think in this place we need some attention here, because we do have the laws that protect us.
Anything
and
particular
so,
happening Sunday? Is the actual World No Tobacco Day?
No, we don't have anything happening on Sunday. Our activities are virtual, but from next week we will be seeing some of those posts that we mentioned, encouraging posts, giving more information, encouraging individuals to join the movement, to join the whole tobacco-free generation. This is our tagline this year. We also have, as I said, some Facebook interviews. Well, it will be on Zoom, but publicized on Facebook. This year, it will be virtual. We don't have any big events happening, but this is our way of remembering that this is an important occasion and marking the occasion.
Okay, sounds good. Well, I've been tobacco free and I intend on keeping it that way. So
yes.
thank you for the encouragement as well. And thank you so much for joining us today at the Information Command Center. And it is our hope that St. Lucians take heed to the warning, especially at this time when COVID-19 is still an issue. And one of the many defense mechanisms besides practicing good hygiene is boosting our immune system. And certainly, all the research points to the fact that the smoking affects our immune system and is also responsible for overproduction of mucus, which in turn is connected to chronic bronchitis and other health issues. So we want you to remain safe, St. Lucia. So St. Lucia, my plea is for all of us to continue to take responsibility for our own health now and beyond, and to remain safe. Today, I leave you with this message from our little ones.
Hello everybody, the secret is out.
What could that secret be?
We're starting a smoke-free generation with you.
You, and you. May 31st is World No Tobacco Day all over the world.
The Substance Abuse Advisory Council Secretariat of the Department of Health and Wellness
Hello everybody, the secret is out.
What could that secret be?
We're starting a smoke-free generation with you.
You, and you. May 31st is World No Tobacco Day all over the world.
The Substance Abuse Advisory Council Secretariat of the Department of Health and Wellness wants everyone
To live well.
healthy and long.
Wow! Let's join this movement. Say no to smoking. Inhaling any kind of smoke is bad for your health.
Don't use any electronic cigarettes.
Don't smoke in public places or workplaces. Parfime, Ikaitreu. Let's make every day World No Tobacco Day.
This message is brought to you by the Substance Abuse Advisory Council Secretariat and this station.